Ladies and gentlemen, good afternoon, dear professor. Thanks you for your kind introduction. Today I have prepared for you a very interesting case, but before starting, I'd like to share with you a prosthetic sequence of my case, please. This is the surgical guide that I have prepared based on my virtual planning. After surgical guide, my dental technician, please. My dental technician, starting from the master model, have placed, please, the surgical guide on the model. So he have used this surgical guide to place the implant analogs in the same manner as planned by me. So we have realized, we have fabricated a master model with the analog inside, and we have fabricated the definitive abutments. Finally, we have prepared temporary restoration that will be cemented on the final abutment. Okay. Now we are ready. This is the first guide. Today I will use two guides because I want to leave teeth in order to make my guide very, very stable. I have already performed the anesthesia and I already set the fit of this guide. So we are ready. Janina? The first step is to place two anchor pins in the palatal area in order to stabilize the guide. Apri, Cinzia. Togli. Okay. One. Apri bene. Togli. And the second one. Open. Anchor pin. Ok, we fit the guide. Prepara le dime riduttori. 1 and 2. Now, surgical guide is stabilized. So we can start with the surgery. Mukotomo? Yes. The first step, I make a sign in the planned position of the implant in order to remove soft tissue. 2, 3, and 4. I remove the template. Aspetta, prendi il template. And I finish to remove the soft tissue. Togli l'acqua, basta l'acqua. 1, 2, spira qua. 3, and 4. Okay. Okay. Sì. Right? We can remove and make again the surgical template using anchor pin as a key. Riduttore mini e preso. Mini, dammi anche regular. Sì. Okay, we are planned 4 implants, 2 mini on the anterior area, 2 regular in the posterior area. Then we will have another 2 implants in the molar position. But for these 4 implants, all the implant is 11.5 millimeter length. So I will use same drill for all the implants. This is a reduction And now I go directly to the surgical guide. 1, 2. Questa non serve più. This is a different reduction because we have different diameter of the implants. 1. And 2. Cambia la presa da 3, il riduttore da 3, mini e regular. This is the next step, the drill 3.0. In the anterior area, in order to find a good stability, this is the last drill for the anterior area, but I don't use the drill for all the length. I stop about 3 millimeters before. The same in the second anterior implant. For the posterior, I use the same drill. This is the second drill, but I will have another drill, so I can use for full length. 1. This is a good bone here, not more in anterior. Ok. Vai. Presa da... Sì. Devi raccogliere una guida che è caduta perché ci serve per dopo. Questa. Not in the anterior area, just in the premolar area, but the same, I use this drill not for full length, just 1-2 millimeters before, in order to make a little under preparation. Prepara gli impianti. We are ready with the first 4 implants. Sì, guarda i regular, qui dobbiamo riutilizzarli. Simple corto. Cambia il programma del computer. Fisiologica. Sì, prima regular. Vengo di qua. Ok, this is the first implant. I have the guided mount. So, I will place the implant, directly to the sleeve. No. We can check the torque. We have 6 now, 7, improve. Okay. I have prepared immediate loading, so prima mano, il kit a mano, okay. I need to place the angle of the mount with a sign that I have prepared in advance. Please, mi dai per favore la prolunga, sta nel kit base o anche qua, guarda. Ok, no, c'è una prolunga nel kit base. E una sonda, Stefi? Sonda? Okay, please. This is a sign on the surgical template that allow me to place the X of the internal X of the implant in the same manner that the dental technician have already used. So I need to place one of these side of the X perfect align on the sign. Dammi il kit, trovate la guida? No, dammi tutto il kit. Mi passi quell'altro kit. Serve una prolunga, che sono queste. Ok. This is a very important step. Ok, ancora sonda. Questo lascia qui, sonda. Now, the side of the mount is aligned. Ok? Ragazzi, possiamo andare sul secondo impianto. Secondo impianto, motore. Metti il simpo. Okay. second implant. Both premolar implant are 4.0 diameter implant. Yeah. For the first implant, I've reached 13 Newton. Now we have 10 Newton, improve, 20, 30, a little bit more, okay. Okay, I stop at 39 here. Did I mount? Again, I need to place the X align on the sign of the surgical guide. Okay, now we have to place the implant in the anterior area. Ancora il mount, il manipolo e i due impianti mini. For the anterior, we have already 11.5 millimeter length, but 3.5 millimeter of diameter. Newton of torque, improve, 20, okay, 28, I hope to reach 13, 35 for each implant at least. Now a little bit more, the same, I have oriented the X with the sign. Now the last of the anterior implant. Steffi? Here a little bit more, already 10, 20, 28, 13, stop, 32, 31 and 3, okay, a little bit more. Okay, I've placed the first 4 implants. Now I will remove the template. I need to perform 2 extraction and place the second template. No. Okay. We have a little bit fit because the mount have X on the end. I will remove also the anchor pin that I will use to place the second template. Sorry. Vai, adesso viene di tensione. Ok, fisiologico. The first 4 implants have replaced. Pinza. Ok, seconda guida. Now, I have to place the second guide, but I need to extract the molar before. All the teeth have very low periodontal support, so I think that I have no problem to extract it. But I need to extract the teeth in a very, very careful manner in order to maintain all the bone. This is the first one. The second one is probably a second molar, a little bit tilted mesially. No, don't leave. So, this is the tooth that have much bone, but as you will see, all the teeth have monoradicular with high mobility. No, two. Vai. Cucchiaino alveolare. Abutment. Sì. Aspetta. Physio and antibiotic solution. This is Rifocin. Che principi attivo è? Rifampicina. I use antibiotic solution for a few minutes and leave inside the socket. Now we have the second template. I have never been tested this before because patient had tooth. Now I test the fit. That seems to be nice. And check with the anchor pin. Two anchor pin. One. The second one. Apri bene, Cinzia. Ok. Ok. Now, the last two implants. On the right, I have 5 millimeters of residual bone. On the left is a post-extractive, but as I told you before, the root was distally tilted, so my implant site preparation is not perfectly inside the socket. This is a complex situation if I work in a freehand approach, but by a guided surgery, I don't have the risk to shift my drill inside the socket, and I can go through my planned position. Mucotomo? E mi devi cambiare il programma. No, me lo devi montare. Per favore. Uno qualsiasi. No, me lo devi montare sul manipolo e per favore mi cambi il programma. Ok. Tranquilla. Ok. Initially the same procedure. I sign the implant site and remove a little bit of soft tissue. Sometimes I don't remove the soft tissue, but in this situation I have the definitive abutment. So I need to remove the soft tissue in order to be sure that my abutment fits without any resistance. Apri, 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 apri. Respira col naso, Cinzia. Manda giù, è acqua. Manda giù, se no non succede. Vai, pulite un po' per favore. Open, apri per favore. Ok, the first one. Date una pinzetta per favore. Second, I don't need because it's a post-extractive. Metti per cortesia, prepariamo tutto a sinistra, quindi le frese da 11,5, iniziando dalla 2. La lima. E ancora più. E il riduttore regular. Cinzia, respiri profondi con il naso, non c'è niente in gola, manda giù, respiri profondi con il naso. Open please, apri. Fai respiri profondi con il naso, apri. Sì. 1 minute for patient, apri. Bravissima, respira col naso e manda giù, tanto un pochino d'antibiotico magari non ha un buon sapore. Ok. Vai. Riduttore? Sì, da 2 regular. I mini non servono più. Poi prepara gli step successivi. Ok, on the left I have 4.5 mm of diameter, 11.5 mm length. Apri grande, grande, grande. Ok. Step successivi. Questi non li dovremmo più usare. Le frese ma le guide sì. The second one. Apri bene. Now I have to use 4 drill. In the same manner, the last drill will be used for half to third of their length, of its length. This is 3.3 drill, not the last because diameter is 4.5. Poi dopo abbiamo le stesse guide, ma quelle con gli stop. Ma le prese con gli stop. This is the last, not for all the length, just for half of drill, in order to allow the implant insertion. Prepariamo a destra, quindi mi ridai la guida da 2. I will place the implant simultaneously, so now I shift on the right. Guida da 2, regular. Ok, e la prima fresa con lo stop. Ok, quella è già stoppata. Poi mi servono le 2 guide successive. This is a drill, straight. I place stop. 10 plus 5 millimeter. 10 is the length of the reduction, plus 5. Because is my distance from the sinus. Apri. Ok. Altra rima con lo stop. .0 drill. Again with stop 5 millimeter. Sorry. E l'ultimo. Last drill is 3.3 in order to allow the tools of the casket. Okay. Now, I remove the surgical guide and I will perform sinus lift elevation using the casket but with a flapless approach. Mi serve la presa da 3,3 con lo stop da 6, da 9. Sì. Sonda. First for implant site preparation here, and implant site preparation here. Now I feel the bone, so I use the conventional casket drill. Sì, ma me le devi montare. No, queste sono della guidata. Dove è il casket? Sono queste. 3,3 con stop da 9. Ok, this is the 3.3 drill, but the stop is 9 because I have 5 millimeter residual bone, but soft tissue. So I start with 9. Obviously, very carefully. Probably I feel the sinus floor, sonda, con lo stop da 10. Lo stop? No, sonda casket con lo stop da 10. Ok, this one. E preparate la fisiologica con il casket. Next stop 10. I feel membrane. So I'm ready to start with the casket procedure, the sinus floor elevation procedure. Dopo. I will place, mi date una pinzetta per favore? Vai tu, Berto. No. Through the gengiva. Okay. You already know better than me this procedure, so I go quickly. Now we set material. Stefani, prendi uno specchio da foto pulito, per favore. Sì. E il portatore, Giannina, tu rimani qua. No, va bene, non serve, dai, vieni qua. Ok, mi date il materiale, per favore? Tutto. Ah, l'idrossiapatite però, quello nostro. Tieni, Erta. Ok, we are ready to perform the sinus graft. Un'altra vaschetta? Sì. Dai, quella là, piccola. Metti dentro. We use QoS Plus. This is a mix of hydroxyapatite and beta-tricalcium phosphate. We have material in different sites. For the sinus elevation, we use small sites in order to allow the placement through the cascade tools. Then, for the socket preservation procedure, we will use bigger sites. No, mi serve questo. È una sonda normale. Erta? Hydroxyapatite is very material with high permeability, so it's easy to use, but it and not a very nice handling. Using these tools allow a very easy and quick procedure. Prendi una sonda normale, pronta se mi serve. Preparate gli altri due impianti, per favore. No, non serve. This is 0.5 cc of material. Implant is the same, 4.5 millimeter of diameter and 11.5 of length. Devi tenere questo, quindi la sonda la puoi appoggiare qua, così mi tieni questo. I think that is enough. Giusto, Erta? Ok, togli. Mi dai la guida, per favore, con gli anchor pin. Ok. Same guide. One. Mi dai per favore i due impianti. And two. We are ready for the last two implants. 4.5 diameter. Apri grande. Il programma è cambiato? Ok. Okay, already 20. Okay. 24, little bit more now. And always I need to place the implant with the side aligned on my sign. Okay, it's not clear, but I think that it's correct. 1 and 2. Okay, the last implant. Preparate poi l'Osstem mentor, per favore. Apri bene. Ok. Tieni per favore. Ok, ok. Gira a destra. Ok. Devo preparare il materiale dopo per la socket preservation, cacciavite, materiale per la socket preservation e le altre estrazioni. Ok, all the implant have been placed. The last implant is not a good stability. Now I will measure with the Osstem mentor device. I will decide if to make the temporary restoration a little bit shorter or to link all the implant together. One. Apri. Bravissima. Specchio. 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 I don't know if you, oh, sorry. Okay. One implant in the anterior. I try to show you the posterior implant. It's not too easy to see. Okay. Osstem, regular. Seminio regular. Okay. Tieni, Erta, fai vedere. 75. O avvicina la telecamera. Ok. Sir. $63 and $64. Mi dai il mini, per favore? No, non va. No, probably it's not correct. No. I don't feel fit of my smart peg. Probably it's not the correct smart peg. Okay. Now, socket preservation procedure, extract the last 3 teeth. But before the last teeth extraction, I want to place my abutment. Vai, dammi prima gli abutment. Dammi gli abutment. No, senza passare da fuori. Ok, cacciavite. The first one. Control torque, poi mi serve. Ok. Secondo dopo. Okay. Aspetta, I'm not sure for the first one. Okay, perfect in time. Oh, perfect. Eh? Sì. Respira per favore. Fisiologica per favore. Vai lava. Anche qua. Ok. Mi dai per favore i mount a mano libera. This abutment is not perfect aligned, so I can move the implant X if need. I can back later. Terzo. No, kit normale. Ok. Probably some soft tissue, è fisiologica. Aspetta. Respira. This is the procedure that requires more time. We have placed all the implant in 35 minutes, more or less. We have time to place the abutment and temporary. Dai il mucotolo per favore. Montato. Mi cambi programma. Mi cambi programma. È fisiologica. Soft tissue. Tieni. Pinzette. E mi ridai la Batman per favore. E un pochino d'anestesietta intanto. Mi dai una lama per favore. Anche questo. Probably there is also a little bit bone because the implant are a little bit deeper. Mi dai l'abutment? No, quello usato? Dove sta? Ok. Fisiologica. Preso il kit a mano libera? Ok. I think that now is good, just to check. Ok. L'altro. Che cosa? Che cosa? No, adesso no. I need to check the X. No, mi serve il mucotomo. Also here, some tissue on the palatal area. Sì, va bene. Tieni. Fisio? Qua? No. Ok. L'ultimo? No. Apri. Apri, 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 apri. Apri, apri. Apri, Cinzia. Ok. Pinzetta. This is definitive zirconia abutment with metal connection that fit and it will be fixed after screwing. Apri bene? Ok. Ok. Paolo potrebbe essere, vedi la posizione, dov'è Paolo? Allora, control torque. Non me l'avevi fatta una dima per provare gli abutment, vero? Metti bene l'altra gate. Open please. Non lo so se questo è da girare un po'. This implant are not a good stability, so we will exclude by the temporary. Allora Paolo, possiamo fare? Paolo? Mi serve Paolo. Ok. E l'impianto sul 26 non lo voglio caricare. O lo tagliamo, possiamo bucare sul 25 e uso il dente, oppure ci fermiamo al quarto. È un problema, c'è il rinforzo sul 25? Prova intanto, o lo lascio. Ok. Sì. Now, però questo qui non volevo estrarlo. Me lo buchi intanto per favore, tanto no. Ok. Ah, ok, perfect. Okay, all the implant but not one have a good stability for immediate loading. So I will shorten the temporary on the second premolar. Me lo puoi tagliare per favore? 26, taglialo tra 24 e 25. I can extract teeth and then remove the implant, remove the abutment in second molar position after left and place a cover screw. Mi serve una vite di guarigione bassa verde. Ok? Little bit anesthesia. scusa. Ok. This is oplet teeth, very easy to remove it. Scusa Cinzia. Apri bene. Also this one. Oh. Dai per favore una leva. No, una leva, leva. Vai, tooth it. Vai. Hai mobility, prendi la pinzetta, aiuto. Yes, just to... Devi lasciare fino a 24. Just soft tissue. And the last. Pinzetta. Mi dai un impianto da 11 che misura abbiamo? Da 5, scusa. Ok. No, mi dai per favore cacciavite. Open please. Apri. Aspetta. Questa connessione. Allora, mi serve una sindesmotoma. No. I need to remove the metal connection between the abutment and the implant. Ok. And no, mi date 5 per 11 e mezzo, ce l'abbiamo? Ok. Sì. Sì. Ok. Now I have two possibilities. We have 10 minutes left. This is the temporary. Okay. It's almost good. Just some little... Paolo? Ok. Oh, scusate. Ok. Paolo? Sì? Guarda, vieni. 2.4, no, vieni. Guarda, molto poco, un pochino qua scende bene, qua scende bene, qua scende bene, ok? Lo devi allentare un pochino, ok. Chiudi Cinzia. In the left premolar, the implant notes, the temporary have to go up a little bit more, open. Dental technician, help me. Mi devi liberare un pochino. But I will check also that the abutment go well. Ok, mi dai un attimino con la levetta di prima. No, mi dai il sintesmotomo. Ok. Oh, sorry. Mi dai la pinzetta. Mi dai questo, sorry. Lo so. Probably also some bone here. Sì. Ok. Fisiologica. Via. Ok. No, mi dai per favore la seconda dima? No, dammi per favore il mount. Ok, mi apri per favore l'impianto 5x11,5? Ok. I want to remove the implant in the upper left side and place a bigger implant, 5.0 diameter. Reverse. Open, please. Apri. Change implant. The same implant, but little bit bigger. Apri bene. Sir. Yes. Cambia reverse. Dai sempre vite bassa, per favore. Ok, 20 Newton of torque, 80, but I don't load this implant. Apri. Ok, dobbiamo fare le socket, preparate il materiale. Good stability now. Check again the temporary. Paolo poco di più, little bit more. Chiudi, chiudi, chiudi. Molto poco, un po' su tutti. Aperto. Ok. Paolo help me a little bit more. Control torque again. Aperto. Ok. Allora, mi dai curette. Prendi il materiale per le socket. Sì. Now I have 7 minutes left to face socket preservation procedure with the same material used before and place the temporary. Preparate un pochino. No, facciamo senza teflon, andiamo direttamente al tembone. Mi dai anche l'altro? Sì. Aiutami adesso con. Vai. È fisiologica? Fisio? Ok. Same material. No. Preparate i tondini di resorba. Aspira sopra. QoS Plus material have good properties because hydroxyapatite is a good scaffold, but we have also beta tricalcium phosphate that is very nice biomaterial that can induce osteogenesis. On the top I will place just the collagen sponge in order to avoid direct contact with the temporary. Ma comincia a svegliare un po'. Così. Ok. Mi date carta d'articolazione. Vai. Sì. Aspetta l'impianto. Sì. Di là è tutto pronto per la panoramica, immagino. Poi abbiamo 5 minuti di domande e risposte. Ok. Aspira gli eccessi, vai tranquillo. Aspira. Ok. Chiamate Paolo. Paolo? Ah, ok, perfetto. Vai. Apri. Aiutami. Ok. Fisio. Ok. Giù. Giù dal mento, giù il mento. No, giù il mento. Chiudi. Dai per favore carta d'articolazione. Open. Close. Chiudi. Apri. Chiudi. Apri. Chiudi. Apri. Chiudi. Apri. Okay, 3 minutes left. I think that now we can stop here. Patient go to take X-ray, and then my assistant cement the temporary and check the occlusion, but the occlusion is so good because we have one contact for teeth. Apri, up, apri, chiudi stretto, ok, apri, chiudi, apri, chiudi, apri. Puoi prendere I punti da una sonda? Okay, now patient take a temporary, then Dottoressa Erta will remove the temporary, will place collagen sponge like this, pinzetta, like this, up to the socket, just to avoid direct contact with the temporary. Ok, ortopanoramica. Chiudi. Aperto. Vuoi fare una ripresa della paziente? Chiudi. Giù il mento. Giù, 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 giù. Bene, giù il mento. Giù, 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 giù. Bravissima. We don't need to rebase the temporary. Then we'll check in the next day occlusion and soft tissue healing. Okay, thank you very much. 1 minute left to take the panel, the X-ray. What?
Dr. Marco, it's wonderful, wonderful. Thank you very much for showing us the very nice surgery. From now, we have some question and discussion time. If you have some question, please raise the hand and use the stand mic. Any question from the floor?
You have a question? Yes, first.
No. Okay.
Any question? No question? Okay.
Hi, I'm Adam from England, and I'm just wondering, I didn't see you put a
I'm ready.
Stand up, sorry.
But I need to earn the question.
I'm just wondering, I didn't see any membrane placed over the top of the bone graft, and I was wondering if you
sorry.
Sorry.
I have understand just from membrane, but not before.
I saw there was no membrane placed over the bone graft before you placed the temporary bridge. Are you using the bridge as a temporary cover over the bone graft?
No, now, just for now, I have the temporary because the patient have to take the X-ray. After the X-ray, my assistant, Dr. Eserta, will remove the temporary, place the collage sponge, and place the temporary.
That's right.
Using socket preservation procedure, I use collagen tissue graft or other membrane to seal the socket. But in this case, collage sponge is sufficient because the temporary will maintain the collagen on site.
Thanks very much.
Okay, thank you.
Thank
any
you
other
too.
question?
Yeah.
Okay. Yeah.
How was the temporary manufactured? Is it milled?
Conventionally manufacturing. After I've received the surgical guide, my dental technician have modified the master model, placed inside the analog of the implants using the surgical guide. And then we have manufactured in a conventional view using acrylic material and then cut part of the material and use dentin and enamel, but conventional way. No cut.
Okay, thank you. Any other question?
Thank you.
Dr. Marco?
Yes?
You show us very excellent surgery. I have a question
Thank you
about
very much.
indication of this surgery. Fortunately, in this patient had a very intact tooth, not too mobile. But if the patient shows some mobile tooth, how to manage how to fix the template to the bone?
Allora, I have already extracted oplet teeth with the hypermobility. I have leave just teeth with, high mobility, but not so much. Questionable teeth. I have discussed with the patient the opportunity to maintain this questionable teeth, but as you have seen, is a little bit mobile and are not sufficient to cement a definitive restoration. So the step is to remove in advance oplet teeth with high mobility. Sometimes I can leave just 2 or 3 teeth. Using this kind of approach, we need just 3 teeth to stabilize the guide and to perform matching between CBCT scan and the model.
Okay, thank you.
Thank you.
Okay, this is the last question. We have not sufficient time. Okay.
Thank you, first of all, Dr. Tallarico, for a great surgery here. We thoroughly enjoyed it. My question is, at what stage was the bite registration done? Like, how did we open up the bite for the patient, and how did we come up with the occlusal platform?
I hope that I understand well. If I have performed any reconstruction before.
Pardon me?
you have asked me if I have performed any reconstruction, bone reconstruction before. I don't understand because the audio is not so good.
Yeah,
Can you
so we did the upper temporary, right? Upper temporary bridge for the patient.
Yeah.
Like,
Yeah.
did we do any bite registration or did we open up the occlusion for the patient?
No, okay. I have tested before walks up. I work in articulator with facial bone and centric reduction. Now I've checked just for centric occlusion in order to give to the patient one contact for teeth. Patient have not molar in the posterior area. So now I've not much time, but in the next day patient will have soft diet, but in next appointment I will check the occlusion, both centric and centric contact. For the first day, I will give to the patient a functional occlusion in order to have as much contact as possible during lateral exclusion, and one contact in static movement.
Thank you.
Oh, this is the orthopantomograph. Implant is good. Unfortunately, the post-extractive implant have not a good stability, but I have removed and placed an implant a little bit higher. The implant in the post-extractive side is a little bit deeper because it's post-extractive. But this is the beautiful of the life. I hope that is very important to see also some problem and resolution. Before surgery, patient have not molar, so he gained 2 teeth.
Yes, yes.
Not 4, but just 2.
Yeah, thank you very much, Dr. Marco. You did a very good job. Please give him a big hand.